and welcome to Clinical Simulation Day, Part 1. My name is Kathy Sokol, and I'm a clinical instructor and a simulation lab coordinator, and I'm going to share a unique way that we use simulation to fill out our clinical day. What happens when a clinical instructor asks you what they can do to fill an 8-hour clinical day? That is exactly what happened to me when I was the Learning Lab Simulation Coordinator. It seems the hospital told the instructor that Joint Commission was coming in the following week on the day of her class, and the hospital didn't want students around. We discussed our options. We could set up skills practice cubicles where the students would review Foley, NG, and IV insertion and removal. They could practice doing various kinds of wound care. They could watch videos on the skills. Each of these options complied with the State Board of Nursing as a replacement for live, in-person clinical. At the time, affordable virtual simulation was not available. I asked her to give me a little time to think about it, and I'd get back to her. She agreed. Later in the day, I called her office and asked, what if I could duplicate a clinical day in the lab? The instructor was intrigued. Since this was a med-surg clinical, the patients were all adults with various medical diagnoses. Each student would be assigned a different patient. Students would perform all the care for their patient since there were no nursing assistants available. The charge nurse was the clinical instructor. Students were expected to call on their peers as they would in the hospital setting if they needed help with their patient. We had 6 students, 6 mannequins, 6 different diagnoses, 6 patient charts, 1 nurse's station, 1 medication cart, 1 stocked supply cart, IV tubing, pumps and bags, and patient care items. The patients were selected based on typical admission diagnoses the students were seeing in the hospital. Of course, you could modify your patients based on the kind of problem you see in your area. In addition, we were limited somewhat to the sex of the patient due to the available mannequins. We had 5 adult mannequins available, 2 males and 3 females. We used the pediatric mannequin by telling the students he was a professional jockey whose horse had fallen on him, fracturing his left humerus and tibia. The students bought into the scenario without much prompting and treated him like an adult patient. Suzanne Brody had atrial fibrillation. Stacy Checketts was a GI bleed. Bobby Sisko fractured his left humerus and left tibia. Paula Reynolds had a CVA. Jenny Brown was diagnosed with a UTI and sepsis. And Velma Watkins was being treated for a gastric neoplasm and CA of the lung. Each student had special nursing care to perform for their patient. We wanted to make sure they would have the opportunity to perform skills they had learned but weren't allowed to do in the hospital, such as initiate a heparin drip or give parenteral opiates for pain. In addition, we understood that you can't predict what will come up on any clinical day. Sometimes the students spend the day doing vital signs, perform an assessment, and not much else. Suzanne Brody with AFib needed a heparin bolus and a drip. Stacy Checketts with the GI bleed needed NG to low intermittent suction and a blood transfusion. Bobby Sisko with the fractured left humerus and tibia needed IV pain meds. Paula Reynolds with a CVA needed telemetry and continuous IV fluids. Jenny Brown, diagnosed with the UTI and sepsis, needed IV fluids and IV antibiotics. Velma Watkins, diagnosed with CA of the stomach and the lung, needed IV fluids and a dressing change to her surgical drain site. Traditionally, nursing students have restrictions on some of the drugs they are allowed to administer. This is dependent on the individual state's Board of Nursing regulations. Our students did not have any restrictions in the Learning Lab, and we built these opportunities into the Clinical Sim Day. We used a standard medication cart like those found in long-term care facilities. We were unable to fund a medication dispense system, so each patient was assigned their own drawer in the cart. Each drawer was filled with that patient's prescribed medications. Large volume IV fluids were on a special cart, and the students had to select the correct one along with the correct tubing. IV piggybacks were placed in the patient's drawer. If a medication was missed, sometimes I forgot to add one, the student called the pharmacy and a tech brought it to the unit. A locked drawer in the med cart held controlled substances. We used a sign-out book which tracked the date, time, drug and dose that was taken, the student's initials, as well as the count left in the drawer. The key was usually held by the instructor. Students had the opportunity to practice setting up and programming 3 different IV pumps used in the lab. These were similar to the ones being used in the live hospital setting. Before any medication administration, students were checked off on the 6 rights of medication administration. All pre-assessment, such as blood pressure or heart rate, had to be completed. Lab values for drugs such as heparin or insulin had to be reviewed to determine safety of administration. Our school did not have the budget to purchase an electronic health record for student use. I thought about this for a long time. I finally decided to create an Excel patient chart that could be loaded on the computers. I will show you how I did this on another video. The charts were fillable and the student was expected to document their care during the clinical day. The instructor would review each student's documentation, just like in the hospital, to evaluate for accuracy and completeness. We also had paper backup charts in the event the computers went down. They were on the same server as the rest of the campus. And that duplicated all the information that was on the Excel chart. Ready, set, go. Everything is in place for the clinical simulation day. Part 2 will take you through how we made it happen and what a typical clinical simulation looks like. Thank you for listening.